Hi guys, and thank you Saya for having me on I'm Not Okay. You guys are doing some really amazing work in promoting mental health. My name is Dr. Varsha Maharaj and I'm a specialist psychiatrist. I'm practicing at Akiso Hospital in Umhlanga and at Life St. Joseph's Hospital in Entebbe. I've been qualified as a specialist since 2014 and I've been in private practice for the last 7 years. My special interests are in child and adolescent psychiatry, but I practice as a general psychiatrist. And being a psychiatrist, some of the disorders that we treat kind of really broadly include things like mood disorders, and these are conditions like bipolar mood disorder or major depression. We treat anxiety disorders very commonly, and these are disorders that include things like obsessive compulsive disorder, post-traumatic stress disorder, generalized anxiety disorders. We treat substance use disorders, and these are in patients who have either issues with dependency to things like alcohol or other illicit drugs. So people come for detoxes, people come to help with their addictions, and those are also things that we treat. Very importantly, when it comes to substance use, is that we often see patients who have a dual diagnosis. So they'll suffer with a substance use disorder as well as things like depression or anxiety, and we help to treat kind of all of those conditions at the same time. We also treat, especially in females, eating disorders, so things like anorexia or bulimia, and then we treat, the spectrum of what we call psychotic disorders, and the most common one I think that people would be familiar with is something called schizophrenia. We treat all of these different illnesses with different types of medication, and the types of medication is a really large, vast topic that I think we can do an entirely another video about. But very broadly, we use things like antidepressants to treat things like major depressive disorder. We also use antidepressants to treat anxiety disorders. Although depression and anxiety occur very commonly, we use exactly the same drug to treat both disorders. We use things like mood stabilizers to treat bipolar mood disorder. We use antipsychotics to treat things like schizophrenia. And I think it's really important to remember that when you visit a psychiatrist or when you visit a doctor who's treating these illnesses, we never really have kind of a one-size-fits-all approach. All of our treatment is really individualized to the patients that we are seeing. And it doesn't even mean that every patient needs medication. Sometimes we see patients who have a mild illness. And in those patients, we would just recommend that they have therapy and we don't even put them onto medication. So I think a lot of people are scared to visit a psychiatrist or scared to go onto medication because they don't actually understand, kind of how we treat it. We're really conservative, and I try to keep patients on the lowest doses of medication for the shortest durations of treatment if they do need it. And people have this kind of common misconception about a psychiatrist, about when you come to take medication, the medication is going to change your personality or dull who you are or kind of just make you, really foggy. And that is quite untrue. Does medication have side effects? Yes, a lot of medication does have side effects. But if you're, getting it from a specialist or, from a general practitioner who, understands the medication, then it really is quite safe. Whenever we start treatment on any patient, we always advise about the list of side effects that, may occur. So things like weight gain, appetite changes, sleep issues, these are issues that can occur with some drugs. And then we also just kind of advise, you shouldn't be mixing medication, you shouldn't be taking medication with alcohol. So these are discussions that you will have, with your psychiatrist or general practitioner if we decide to start medication on you. There is also quite a role in mental illness for general practitioners. GPs are often the very first point of contact within the community, and GPs do an amazing job at just identifying patients that are mentally unwell, starting treatment on them, and then referring them on to us if they feel that the patients are a danger to themselves, if they need hospitalization, or if the first line treatment that the GP has put them on hasn't really worked and they need a little bit of help just in escalating care. So I think more often than not, patients who are unwell, if you're feeling a little bit unsettled, sometimes it's difficult to get an appointment with a psychiatrist, kind of first up. So I think a general practitioner is always a good place to start. I mean, how do you know if you need help? I think with COVID, one of probably the only positive thing that has come out of COVID has been such an awareness for mental health issues. So I think that there's really been a target on just educating people about what do mental disorders look like, when should you be seeking help for these types of illnesses. But I mean, psychiatric emergencies are when we would say you should kind of get help immediately. And a psychiatric emergency would be, if you are feeling like you are a danger to yourself, if you feel like a loved one is a danger to themselves or a danger to anybody else, or if they're, kind of having thoughts of self-harm, these are the types of patients who need to probably go to a hospital casualty and see, kind of a specialist or a doctor immediately, just to be able to help to contain them through whatever crisis they're going through. So I think it's important just to remember that there is actually quite a lot of help available. If you're struggling, you really do not need to struggle. There's help available, from your GP, from specialists, from others in your community, The last 2 years, we've all gone through this absolute roller coaster of emotions. I think we've all taken a bit of a knock to our mental health in one way or another. And it's important to remember that it's okay. It's okay to say that I'm not okay. And if you need help, I think just, kind of contact somebody, even local agencies and support groups, places like SADAG, so the South African Depression and Anxiety Group, are fantastic places as first ports of call if you're struggling and you feel like you need a little bit of help, with your mental health. So I hope this helps, and good luck to all of you out there. Thank you.